my name is Christy Rivera and I will be performing the skill set of drawing up medications. I will begin by washing my hands. First thing, I'm going to put the water on, make sure it's warm, not too hot. Wet my hands, apply soap, and scrub. You want to do this for a minimum of 2 minutes, making sure you get your wrists. You want to get in between your fingers, also your cuticles. Underneath your nail beds. Rinse your hands. Paper towel you want to blot or pat and not rub. Make sure you're dry in between your fingers. You'll grab another paper towel to shut off the water. Now I'm going to begin by setting up my field to draw medication. Because this is not a sterile procedure, we do not have to ensure things inside the field are sterile. I will put my gloves on. We will be drawing up 2 different medications today. One will be a morphine and one will be ceftriaxone. The order is to, once converted, the order will be, I will be drawing up a 1/2 milliliter of ceftriaxone and 0.7 of the morphine. So the first thing I want to do after I get my gloves on is wipe the tops of the vials with alcohol and let those dry. I'll prepare my needle while those are drying. Okay, so on my needle here, you'll see that I have a 1/2. Let's see if we can get that in. There we go. You'll see we're going to draw to the 1/2 line. And then we will draw to the 0.7, which would be the line below the 5, the 1/2 mark for the morphine. Carefully take off my cap. I will draw some air to the 1/2 milliliter mark and inject that into the medication bottle, and then I will draw out 1/2 milliliter, making sure that we try to get any excess air out of there, any bubbles we need to remove, and you'll see that that is at the 1/2 milliliter mark. Next, we're going to move on to the morphine. Please excuse this, as we would not re-inject medications and use the same needle for drawing up in a real setting. This is just for practice. Next, we're going to get our morphine, which is 10 milligrams per ml in the bottle, and the order was 7 milligrams, so we will pull out 0.7 of this morphine. For the ceftriaxone, We were ordered to give that IV, so we will do that IV in a piggyback line. And for the morphine, we're going to pull up 0.7, which is a little bit below the 1/2 mark. Making sure we clear out any bubbles. Okay? And you'll see that that is a little below the 1/2 mark for 0.70. Okay, and that concludes medication drawing for skill practice. We can passively cap the needle, and then we would dispose of it in the proper receptacle.